What happens at pelvic physical therapy for men? Hello, my name is Dr. Beth Shelly. I am a pelvic floor physical therapist, board certified in women's health and pelvic muscle dysfunction biofeedback, and I'd like to share with you some information that is included in the book, Facing Pelvic Pain, a guide for patients and their families. Physical therapists are experts in musculoskeletal problems with muscles, bones, joints, the nerves that innervate them, the connective tissue that surrounds them, and the skin. Pelvic physical therapists have a specialized knowledge of the pelvic structures and the ability to train the bowel and the bladder. So what should you expect on your first visit? The first visit is called the initial evaluation. And there you will have a whole lot of talking, interview and questions about your symptoms, activities that are difficult or impossible, and activities that make things better. The physical therapist will review your records and your previous tests, and then they will test your pelvic structures. What are pelvic tests? Well, they certainly can take a variety of forms, but oftentimes that includes testing the posture and movement in the pelvic area. How are you sitting? How are you bending? How are you standing? What is the alignment of the pelvis and the hips and the spine? And what is the strength and movement of those muscles around the hips and the trunk? Pelvic tests also include touching the muscles to determine muscle tenderness or increased tone in various areas of the hips and the abdomen and the buttocks and the perineum, as well as the function of the bladder or the bowel using a chart, as you see here, what we call a bladder diary. The abdominal wall can pose a specific or unique challenge, and so that would be evaluated as well for pain, strength, and length. The pelvic floor muscle is certainly the most specialized area that the pelvic physical therapist is going to test, and that can be done with both external and internal measurements. Externally, the observation of the rectal movement during contraction and relaxation and bearing down can be very helpful. And also palpating with the finger, touching the areas that you see here around the base of the penis, the pubic bone, on the rectum, the bones you're sitting on, the buttocks area, the groin, the abdomen, sensing for tension, spasm, and pain. There also are techniques that can be used for measuring the muscle on the outside, including EMG or electromyography, where little sticky patches are placed on the outside of the rectum, and then you're covered up and you look at the screen with the physical therapist to see how the muscle behaves when you squeeze and how it behaves when you relax. Another external technique that some physical therapists have is imaging ultrasound. In this case, the transducer with cold goop is placed on the perineum, the area of the body in between the testicles and the rectum. So right up against the outside of you is a transducer with cold goop, and then you're looking up into the body and you can see, as is outlined, the prostate, the urethra, the base of the penis or the penile bulb, and then the change that occurs when the muscle contracts and relaxes. Internally is often helpful to measure the muscle by touching with an index finger inside the rectum. Now, it is very important to recognize that the intent of physical therapy is not to create pain. It is helpful to measure the muscle, but if you are concerned, please discuss that with the physical therapist, because it may be possible to do the initial stages outside the body. Let the therapist know if you would rather not have the measurement on the inside. Understanding that that is the gold standard and it is often useful in ultimately resolving the condition. There also are internal EMG techniques as well. Preparing for the first visit often includes bringing previous records, completing questionnaires that the physical therapist has directed to you, and thinking carefully about what makes your pain worse and what makes your pain better. Make sure to wear comfortable clothes that you can move and stretch and move your legs around, and also clothes that are easy to remove. Again, the goal of physical therapy is to decrease your pain, not increase your pain. Some of the tests may be associated with mild discomfort, but it's really important that you tell the physical therapist when you feel pain or when you feel discomfort or when you're just uncomfortable with it. It is a team effort, and the therapist can't feel what you feel, so you need to share your feelings. Discuss your concerns ahead and know that you are always in charge. I hope that this very short video has helped understand and feel a little bit more comfortable with the things that may be provided by a pelvic physical therapist when evaluating pelvic pain in men. Thank you.